Hi everyone. Today we'll be talking about dexamethasone suppression tests, and this is going to be just a very simplified version to understand how it works. And obviously, the indication for this kind of test is when you suspect any sort of Cushing's disease or syndrome going on with the patient. If you have a patient presenting with hypertension, diabetes, truncal obesity, moon phases, abdominal striae, and etc., then you might be suspecting Cushing's disease. Or Cushing's syndrome. If you see the signs and symptoms of Cushing's, the first thing you want to do is actually to do a low dose Dexa suppression test, not only one test. So this test, thinking about it, if you still have cortisol being elevated, that means you fail to suppress the release of cortisol. So that means that there is pathological release of this cortisol. So if you fail to suppress, then you have an element, or you might be having higher suspicion of Cushing's. Okay? Other alternatives for the low-dose dexamethasone suppression test is to get your 24-hour cortisol levels, or sometimes you want to get salivary cortisol levels. Okay? Now, what you need to know after that is whether the cortisol release is dependent on ACTH. If you look at this graph, we know physiologically that cortisol is under the influence of ACTH. So if the abnormal amount of cortisol is being secreted from or being influenced by ACTH, then that would be different from if the adrenal gland is releasing ACTH on its own. And we know cortisol exhibits a negative feedback on the whole axis. So we can easily just obtain levels of ACTH, right? And if it's high, it's going to mean something. And if it's low, it's going to mean something. If it's low, then you have a problem here. You have a tumor or an adenoma or any kind of neoplasm that is excessively releasing cortisol, and then it's exhibiting a negative feedback on the both the hypothalamus and adrenal gland. So it's non-ACTH dependent type of release. So you might be thinking of primary adrenal tumor. And of course, to evaluate for this, you want to get CT or MRI, okay? But then what if the ACTH is high? So the release of cortisol is actually dependent on the axis itself. Then you want to know if this is a malignant release of ACTH or if this is a non-malignant release of ACTH. So this is where the high dose dexamethasone suppression test comes into play. And in that case, we want to know, does it respond to the high dose or does it not respond? If it responds, that means it's a benign type of release, because high dose dexamethasone should be able to suppress cortisol if it's benign in nature. So you would be thinking most likely Cushing's disease, where you have pituitary adenoma there, and it's the one secreting ACTH, which subsequently is secreting cortisol. So with high dose suppression, you're able to shut off the axis. Again, this is not malignant, it's an adenoma. So Cushing's disease, and this is most likely due to a pituitary adenoma. Obviously, in that case, you obtain MRI, and then you consider options of treatment, whether you want to remove the adenoma through transsphenoidal surgery, whether you want to use non-surgical management options for the patient. But the thing is, if it does not suppress even with high dose dexamethasone, then that's an ectopic release of ACTH. So ectopic ACTH release, and that is worrisome of certain cancers such as small cell carcinoma of the lung sometimes. Paraneoplastic syndrome usually is the word we use to talk about tumors that releases hormones which are functioning. So you want to do CT scan and explore the cause or the location of the tumor causing the ectopic release of ACTH. So, in summary, this test is used to determine two things. First of all, whether we do have abnormal release of cortisol or not, and we obtain that through the low dose dexamethasone suppression test. And then we want to know, is this ACTH dependent or not? If it's not dependent, then that's solitary release of cortisol from the adrenal gland itself that allows for shutting of the axis through normal negative feedback. So that is seen in primary adrenal tumors. But if you have high ACTH, then that means that there is an influence of a higher axis, whether it's by tumor ectopically, which does not respond to high dose suppression because it's malignant, it's out of control, or it might be an adenoma that releases ACTH and therefore cortisol. And since it's an adenoma, it's benign, it does respond to high dose dexamethasone suppression test. So this is basically, in a nutshell, how to think about dexamethasone suppression tests. And yeah, and if you go again, look at the physiology, everything makes sense. So hope this was clear, and thank you very much for watching.